What if your body has been warning you about diabetes for months, or even years, and you completely missed the signs? Most people think diabetes starts when blood sugar becomes dangerously high. But the truth is much more alarming. Your body often sends early warning signals long before diagnosis. The problem? These symptoms are so common that people blame them on stress, aging, lack of sleep, or a busy lifestyle. Today, we'll uncover the first warning signs of diabetes that millions of people ignore every day. And if you recognize even a few of these symptoms, it may be time to pay attention. Diabetes is a condition in which the body cannot properly regulate blood sugar levels. Normally, the pancreas produces a hormone called insulin. Insulin acts like a key. It unlocks cells so glucose can enter and be used for energy. But in diabetes, this system begins to fail. Either the body doesn't make enough insulin, or the cells become resistant to it. As sugar builds up in the bloodstream, damage slowly begins throughout the body. This damage can affect the eyes, kidneys, heart, nerves, blood vessels, and even the brain. The scary part? Many people don't know they have diabetes until serious complications appear. One of the earliest and most overlooked warning signs is excessive thirst. If you constantly feel thirsty despite drinking enough water, when blood sugar rises, the kidneys work overtime to remove the excess glucose. This causes more water to leave the body through urine. As a result, dehydration develops. Your brain responds by triggering intense thirst. Many people simply assume it's hot weather or dehydration. But persistent thirst can be an early red flag for diabetes. Closely linked to thirst is frequent urination, especially if you're waking up multiple times at night to use the bathroom. When blood sugar levels become too high, the kidneys try to remove excess glucose through urine. This increases urine production dramatically. Many people blame aging or drinking too much water before bed. However, frequent urination can be one of the body's earliest warning signals. Do you feel exhausted even after a full night's sleep? Persistent fatigue is another major warning sign. Remember, glucose is the body's primary fuel source. When insulin isn't working properly, glucose remains trapped in the bloodstream. The cells are essentially starving despite having plenty of sugar available. This creates a strange situation where blood sugar is high, but energy levels are low. People often describe feeling mentally foggy, physically drained, and unable to concentrate. If fatigue becomes a daily struggle without a clear reason, diabetes could be a factor. Many people are surprised to learn that diabetes can affect vision very early. High blood sugar causes fluid shifts inside the eye. This changes the shape of the lens and affects focusing ability. As a result, vision may become blurry. You may notice difficulty reading small text or seeing distant objects clearly. Some people simply assume they need new glasses. But sudden or unexplained blurred vision should never be ignored. Have you noticed cuts, bruises, or scratches taking longer than normal to heal? High blood sugar damages blood vessels and weakens circulation. This reduces the delivery of oxygen and nutrients needed for healing. At the same time, the immune system becomes less effective. The result is slower wound repair and an increased risk of infection. A small cut that should heal in days may linger for weeks. This is a warning sign that deserves medical attention. One of the most concerning signs of diabetes is nerve damage. It often begins as mild tingling, burning, numbness, or a pins and needles sensation, most commonly in the feet and hands. Many people dismiss it as poor circulation or simply sitting in one position too long. However, elevated blood sugar can damage nerves over time. If left untreated, this condition can progress to severe pain or loss of sensation. Early detection is critical because nerve damage can become permanent. Another confusing symptom is increased hunger. Even after eating a full meal, some people continue feeling hungry. Why? Because the cells are not receiving enough glucose for energy. The brain interprets this as starvation and sends stronger hunger signals. In some cases, people may actually lose weight unexpectedly. The body begins breaking down fat and muscle for fuel. Unexplained weight loss combined with increased hunger should never be ignored. There is another warning sign many people never associate with diabetes: dark, velvety patches of skin. These patches commonly appear around the neck, armpits, elbows, or groin. This condition is called acanthosis nigricans. It is often linked to insulin resistance. In many individuals, it appears years before diabetes is diagnosed. Recognizing this sign early may help prevent future complications. Certain factors increase the risk of developing diabetes. These include being overweight, physical inactivity, family history of diabetes, high blood pressure, poor diet, smoking, and increasing age. However, diabetes can affect people of all ages and body types. That's why recognizing symptoms is so important. The first warning signs of diabetes are often subtle: excessive thirst, frequent urination, fatigue, blurred vision, tingling sensations, unusual hunger, and dark skin patches. Your body speaks before disease becomes obvious. The question is whether you're listening. If you recognize any of these symptoms, speak with a healthcare professional and consider having your blood sugar tested. Early diagnosis can prevent life-changing complications. If you found this video helpful, subscribe for more evidence-based health education and share this information with someone who may need it. Because understanding the warning signs today could protect your health tomorrow.